Tinnitus is that constant ringing or buzzing in the ears. It's a condition that affects 50 million Americans, and it can be very frustrating when it's recurring. It can even affect your daily life when it's not treated. In this video, I'll go over what tinnitus is, what causes it, effective options out there in terms of treatment, and things you could do right now to better manage your tinnitus at home and help prevent it. So stay tuned till the end. Hi guys, you see Arsalan Media Pharmacist here on YouTube, where I help you guys make better and more informed decisions about your health. This week's video is on how to get rid of tinnitus. Be sure to smash that like button below now to help more people find this video so we can all beat tinnitus together. Also, while you're at it, hit that subscribe button too to stay up to date with new weekly videos. And without further ado, let's talk about tinnitus. First things first, it's important to know that tinnitus is a symptom and not a disease. It's a sign that something is wrong with your auditory system, which includes your ear, the auditory nerve that connects the inner ear to the brain, and the parts of the brain that process sound. So with that said, the methods in treating tinnitus will rely on treating the underlying condition that is causing the tinnitus in the first place. Now, what can some of those underlying conditions be that's causing all this ringing in my ear? Good question. This isn't a full list, but some of the common underlying causes are a head or neck injury in the past, an ear infection, a temporomandibular joint disorder, depression, anxiety, insomnia, Meniere's disease, and certain medications which I've listed below in the description that are known to be ototoxic, which means that they can damage the inner ear. With that said, always consult with your doctor first if you feel like medicine is the cause of your ringing ears before stopping anything. Other possible causes can be a buildup of earwax that's touching the eardrum and constant exposure to loud noises. So if that's you, please have your doctor or audiologist examine your ears, remove excess earwax, and stay away from loud noises or concerts. You see, tinnitus doesn't only have to be ringing. It can be buzzing, whistling, roaring, or even humming. And it's a tough condition for doctors to study because there's really no way to measure it directly. The only way of knowing is if the patient tells us they have it. And if it lasts longer than 6 months, it's known to be chronic tinnitus. But what is actually producing that sound? That's another good question. One of the most common causes of tinnitus is damage to the hair cells in the cochlea. These cells help transform sound waves into nerve signals. If the auditory pathways or circuits in the brain don't get the signals they're expecting from the cochlea, the brain starts to increase the gain to detect the sound signal. It's kind of like when you turn up the volume on a car radio when you're trying to find a station signal. The result is an electrical noise we call tinnitus. It's like phantom limb pain in an amputee. The brain is producing abnormal nerve signals to compensate for missing input. Now, enough background. Let's get into the treatment options. By the time you're watching this video, I'd assume you have tried many options out there. Let me know what your thoughts are in the comments below about any of them. But I say 5 treatments stand out and have been shown to be effective. Number 1. Noise suppression. This especially can help if your symptoms are worsened at night when you're trying to fall asleep. You could try to drown out the noise with some white noise or background noise from fans, humidifiers, dehumidifiers, and air conditioners. There are also devices which produce simulated environmental sounds such as falling rain or ocean waves, which can help mask the ringing sound coming from the ear. Number 2, hearing aids. Many people who have tinnitus also have hearing loss. Hearing aids may help provide relief from tinnitus by making sounds louder and the tinnitus less noticeable. Number 3, tinnitus retraining therapy, which follow-up studies suggest it provides relief for around 80% of people. A trained professional or audiologist walks you through wearing a device that emits low-level noise to retrain the auditory system to accept abnormal sounds rather than find them disruptive. Ongoing sessions are needed, but it has seemed to help people cope better with their symptoms. Number 4, counseling options. Cognitive behavioral therapy or CBT or acceptance and commitment therapy or ACT with a psychologist can help you learn ways to limit the attention you give to tinnitus to help better manage the stress and anxiety it causes. Number 5, visit your dentist. Now you might be thinking, what on earth does that have to do with my ears? Sometimes tinnitus is produced by stress on the jaw and neck muscle, or like we mentioned earlier, temporomandibular disorder. If you're one to clench your teeth or grind them at night, which is shown to be another cause of tinnitus, a dentist can help provide you solutions preventing this altogether. There's currently no scientifically proven cure for most cases of chronic tinnitus, but the search for a definitive cure is ongoing and real progress is being made. So until then, take these next 5 tips I have to prevent tinnitus from becoming worse. Number 1, Avoid irritants. Reduce your exposure to things that may make your tinnitus worse. This includes loud noises, obviously, caffeine, and nicotine. So if you currently smoke, now is a great time to consider quitting. Number 2, manage stress. Stress can make tinnitus worse. Find out what works for managing stress for you and keep a healthy routine with doing just that, whether that's relaxation therapy, exercise, or even talking to someone. Number 3, minimize alcohol consumption. Alcohol increases the force of your blood by dilating your blood vessels, causing greater blood flow, especially in the inner ear. Number 4, if your cause is medicine related, talk to your doctor about possibly changing you to a different form of medicine that equally suffices. Number 5, neck exercises. I left a valuable link in the description below that looks at the top 3 exercises to prevent tinnitus in which you could do right now at home or wherever you are. I really wish I had a long list of alternative options for you guys to try out as well, but unfortunately large-scale studies were unable to prove that ginkgo biloba help with tinnitus symptoms, and a 2016 Cochrane review also concluded that evidence was not sufficient to support taking zinc supplements to reduce the symptoms either. But what I can tell you is that just in 2020, information about recent clinical trials indicated that bimodal neuromodulation may be a promising treatment for reducing the symptoms, which is a non-invasive technique that involves the pairing of an electrical stimulus to the tongue that is associated with the sounds in the ears, which the research is ongoing. But I remain hopeful in it because it's better to move in a promising direction this way. Also, Autonomy is working on a treatment that's currently in phase 3, which I'm also excited about. Because let's face it, the most frustrating thing is when we run out of options. Anyways, guys, I hope this breakdown was useful to you, and I hope that you did enjoy this video and learn something new. I also hope that you do find a better way to manage those tinnitus symptoms. Like the video if you did enjoy it, and subscribe to stay on board with all my other weekly health and wellness videos. Thanks for sticking tuned all the way till the end, and as always, I'll see you on the next one.